Hi, it's Dr. Andrew at Doctors Boyd. Today I want to go over how to properly load our at-home whitening trays. A lot of patients have questions, they get a little bit confused, and today I want to make a video to show exactly how to do that. We'll need two things. First, we'll need our custom at-home whitening tray. This is an upper one that's made exactly for me. Two, we'll need our at-home whitening gel. This is Philips Zoom Night White. It's a 22% carbamide peroxide. It happens to be my favorite gel and what I use for myself. Okay, now we're ready to load our whitening trays. Here I have the upper tray. This one's made for me. And I also have our lower tray. Okay? What we'll need next is we'll need our whitening gel. So here's our whitening syringe with a protective cap on it. What we do is we turn it counterclockwise 90 degrees and you pull this cap off. We take our application syringe, you place it 90 degrees, you push and you turn clockwise so that it engages the syringe. We'll take our cap off and now we're ready to go. So the first thing we'll do is we'll take our upper tray and we want to just locate the facial surfaces of all the teeth that we see when we smile. There's no real need to go to the back molars to whiten unless you have a really broad smile. In that case, you can add a little extra whitening gel to some of these molar teeth. For me, I don't need that. What we'll do is we're going to take a dot of this material, if you can see really the thickness of the tip of that syringe, and we're going to put it on all of the teeth. So I'm going to show you right now. So we'll take this, start depressing the material. You can see it start to mix in the application tip. Once I have a little bit out, I'm going to start to put it on my tray. So I'm going to put a dot here, a dot here, a dot here, here. I'm going to give a little bit more for my front teeth because I have big teeth. Some here, a dot here, here. Let's get over here and here. So that completes our upper tray. You can see there's not very much at all. So let's do the lower. Remember, I'm going to skip the last two teeth because I don't need to do my molars. And then I'm going to start to put dots in. Dot here, 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 all the way around. Now I have my lower completed. You don't want to put any more than one little dot because when you place them in, any excess that comes out is wasted material. That's something that you could have used later at another day. If you look carefully, you can see I only used probably about up to maybe a little bit past the one. So one of these syringes should last you probably 5 or 6 days, maybe even 7 days. We're going to take our cap, put it back on our application tip. We're going to put this in the fridge so that it helps preserve the whitening gel inside of it. Now we're ready to place our trays in our mouth and start whitening. Now that we have our trays loaded, it's time to begin whitening. I'll be using a stone model of my own teeth for demonstration purposes only, but you can apply this for doing it at home as well. So we're going to take our loaded tray, in this case it's the upper one, we're going to place it on our teeth like this, and we're going to press and make sure that it's seating fully. You'll watch, as you can see, you'll see the gel start to spread over all of the teeth. You want to press it so that it covers all of the outside portion of the teeth. Any excess that flows up over the edges like this, you'll want to wipe away with your finger and then wash your hands off with water. The gel's not going to burn your skin on your finger, but what will happen is if you get it on your clothes, it's going to bleach your clothes. So here you can see the tray fits perfectly well. It should feel comfortable in your mouth, and now we begin whitening. Now that we have our trays in, with 22% carbamide peroxide, we will wear them from 2 to 4 hours or overnight. Once we're finished, we will remove our trays and thoroughly rinse our mouth out with water. We also clean our trays and remove excess bleach using water and a toothbrush. There's no need to use any toothpaste. If you have any additional questions, please contact me at our office. Any other information you can get from our bio. Thank you.